We'll call this child Benny, although that's not his real name. We first met Benny as an infant. Benny was being cared for by his aunt, and she came in to enroll him. Although his biological parents are around and see him from time to time, they are yet to get their lives straightened out, according to the aunt. Although we do not know exactly what drugs his parents were on, the local Department of Children's Services were involved with the family. So his biological parents decided it was best to voluntarily put Benny into the care and custody of his aunt. When Benny was first enrolled, he was withdrawn and did not engage as most infants do. So as part of our early Head Start comprehensive approach to both Benny and his aunt, we undertook goal setting, assessments, and stimulation efforts to address his troubling symptoms. Now that he's been in our early Head Start class for a while and in the care of his aunt, he is now smiling, engaging, and playing appropriately as most other children his age do. This is a typical example of some of the challenges faced by Head Start programs. As the opioid crisis has intensified, our early Head Start program, which is for children 0 to 3 years of age, has witnessed some concerning trends. They are more infants in recovery from neonatal abstinence syndrome or in utero exposure to drugs of dependence. More parents have enrolled infants and toddlers actively abusing one or more substances. More children separated from their parents and placed in the child welfare system are placed with a relative, like a grandparent, due to substance misuse or related neglect and abuse, and more distinct and challenging behaviors such as lashing out, incessant crying, and aggression. The impact these events have on a young life cannot be overstated. As many of you know, the President's Commission on Combating Addiction and the Opioid Crisis released its final report on November 1st, 2017. The report noted that any federal response must prioritize comprehensive, family-centered approaches and should ensure families have access to drug screening, substance abuse treatment, and parental support. The Bipartisan Policy Center agreed treatment programs that engage the whole family and treatment facilities that allow parents to stay with their children achieve better treatment outcomes. The family-centered approach is not a new idea or concept. In fact, this is the Head Start and Early Head Start model. As an Early Head Start program, we, as many other programs like ours across the nation, use a multi-generational model to address the child and family's needs. As a part of that approach, we begin by engaging the family in an assessment process whereby we work to learn about the challenges both the child and parents or caretakers are struggling with. Along with identifying the challenges, we also strive to discover the family and children's strengths as well. Although this approach is typical for the way we operate, it's all the more important in situations like what we're talking about where the family is dealing with drug abuse and especially opioid addiction. In most instances, we do not have contact with the family until someone comes to enroll the child. And our experience is that in some of the most significant and evident challenges the children have in these situations is that they exhibit acting out or behavior issues in the classroom. When we encounter these kinds of behaviors in our program, we use our trained and experienced behavioral staff as a first response to work with our teaching staff so these teaching staff can better support the child. What we found is that the Early Head Start and Head Start model is especially well suited to working closely with these vulnerable and affected children by increasing their protective factors, which are the conditions and attributes such as skills, strengths, resources, supports, or coping strategies that help the children respond more effectively despite stressful events of their environment. Furthermore, our programs in Head Start are about understanding and working with the whole family. This may involve home visits or possibly referring mom or dad to another useful partner organization or services in the community and then following up.